So as far as some drugs to watch for in 2019, there's actually going to be 4 new oral medications for MS. Just want to highlight one of them. So cladribine. This is a little different mechanism. It helps silence the immune function in the brain in patients with MS. Seems to be effective. What's interesting about this medication is the dosing of it. It's given once daily for 5 days, 1 week. Then a month later, it's given once daily for 5 days. That regimen is repeated in year 2, and then that's it. So it's very unique as far as how it's administered, so that'll be an interesting new option on the market for patients with relapsing MS. Another gene therapy to watch for is AVXS-101. So this is for patients with spinal muscular atrophy type 1. So that only represents patients with from birth to 6 months, and it's a very severe form of muscular atrophy where these patients or babies aren't able to crawl or walk. They have difficulties breathing and eating. Only about 8% of babies diagnosed with this survive to 20 months of age. So there's a need for treatment options for them. We do have Spinraza, which is an intrathecal medication. It works differently. This is a one-time infusion gene therapy that has demonstrated strong efficacy in clinical trials. This could cost anywhere from $1 million to $3 million for the one-time infusion. And then we also have tafamidis as an interesting drug to watch for in 2019 as well. So this is for patients with cardiomyopathy due to transthyretin-mediated amyloidosis. So this could be used in patients that have hereditary form of disease and wild type, which just occurs as people age. When patients finally get this diagnosis, it takes a long time to diagnose these patients. Their life expectancy is only about 3 to 5 years because they progress rapidly to atrial fibrillation and heart failure. So this is an oral medication. It's going to be approved next year to treat these patients, and it looks like it's going to be a pretty effective medication. In clinical trials, we saw a 30% reduction in mortality, as well as like about a 32% reduction in cardiovascular related hospitalizations as well. So watch for that, probably mid-2019.